Welcome back to the ACL Academy, and this is Dr. Kaan, and today we're going to talk about one of the key factors to getting your ACL recovery process off to a rock star start. Before I do, if you guys have been following along with these educational videos weekly, and if you found some value in there, please like the videos, please subscribe to the page, please share with a friend. So today, one of the key factors, okay, getting your ACL recovery off to a rock star start. You hear me talk about the primary focus after surgery is getting that extension back, and that is still the primary focus. But there is a little something that you can do to help all facets of this recovery process, and that, my friends, is swelling control. So if we can get our knee and under the fluid, if we can get that fluid under control early on with this process, the better it will be for everything. That's extension range, flexion range, getting that quad muscle back. Swelling plays a key role in all of this. And why is that? Well, swelling is a clear indication of how much the knee joint is being stressed. Now, after surgery, right, think about this. They cut your knee open, they put some tools in there, and they shave some things down, they cut some things out, they replace your ACL, right? So there's a lot of post-operative swelling. Swelling is important because it's the first phase of healing. So your body will send more fluid, more nutrients to that area to help start the recovery process. But too much swelling can end up being or causing some issues for us. One, it can prevent us from gaining range of motion. Two, the more fluid in the knee joint, unfortunately, it stops the quad muscle from working as good as well. So if we could take care of this fluid buildup early on, it will speed up the rest of the process. So what can we do? The most important thing that we could do after surgery is time off of our feet. We don't want to be standing too much. We don't want to be walking around too much. We don't want to really initiate any type of weight-bearing exercises early on, as this is going to cause more stress to the knee joint. More stress to the knee joint is going to cause more swelling. So super important after surgery, you have some support, right? Whether it's family members, friends, spouse, girlfriend, boyfriend, whoever it is, to help you, okay? Get a nice little room set up for yourself where you're near the bathroom, where you're near the kitchen, where if you need to get up, you can. Small household distance is okay. Other than that, you want to be off your feet as much as you can throughout the first week. Doesn't mean you won't be doing anything, right? You will be doing some exercises. You will be doing some range of motion work for your knee. You will be doing some muscle activation work for the muscles around your knee joint. So there's plenty that you will be doing to get the leg moving, but we're going to limit the time off our feet. So that limits standing, that limits walking, that limits really no weight-bearing exercises that first week, okay? The other thing that we're going to be doing is elevation and compression. These are two super important factors to utilize to get swelling under control. Why is elevation important? Well, a big part of our circulatory system and how blood gets pumped back to the heart is our muscles functioning. Now, after surgery, our muscles in our leg are not going to be functioning too well. It's going to be hard to pump a lot of that fluid and nutrients back up the leg. So we're going to use gravity as our assist. So it's so important that you get on your back, get the whole leg elevated from the hip all the way to the foot and ankle. So this way, gravity can do its thing and can help us with some of that swelling management. It's super important that the leg is elevated above the heart. So this way, it can get a little bit of assist there. The other thing is reduce compression. So when you're sent home, most likely you're going to be sent home with some sort of wrap, ACE bandage. It's important that you keep this on. So, and you re-wrap it and check it every few hours is our recommendation. So when you're doing your exercises, right? So when you're doing some range of motion work, when you're doing some quad activation, it's okay to take the bandage off, right? So this way it doesn't restrict your movement. Once you're done with your exercises for that time period or time block, important that you re-wrap the leg nice and compressed, because compression will also help with that swelling control. So there's a lot of evidence to support that the faster we can take care of the swelling, the better our quad muscle, that front thigh muscle, that's the main muscle that we're really focusing on after ACL surgery, has better activation. So it'll be able to activate better. You'll be able to get a stronger contraction. You'll be able to get it going faster if the fluid is out. The other side of swelling is the less swelling it is, the more free the knee joint will move, right? The more fluid in the knee joint itself, there's just so much in that area, you're not going to be able to bend it and straighten it. So if we do have more fluid there, you're going to have a tough time getting your bending back and a tough time getting your straightening back. So on both sides of that, when we're working on that foundation phase of the ACL recovery process, that first month or so, the main things that we're working on are range of motion, extension being a priority, top priority, then flexion, and then of course getting that quad muscle going, getting it activated, and then beginning that strengthening. We can't do any of that when the knee is a balloon, when it's filled with fluid. So the key to success here is take care of that fluid early on. Take care of that swelling early on. Time off your feet, less time walking, no weight-bearing activities, and you will set yourself up for a rock star start. If you have any questions, drop them in the comments. As if you found value in this video, please like, subscribe to the page, and tell a friend. I will see you next time here at the ACL Academy. This is Dr. Kaan signing.